We are honored to be joined. It has been several months, but we are honored to have back with us Dr. Scott Atlas, now with the White House Coronavirus Task Force. And it's a pleasure, Scott, to have you with us. And on a personal note, I'm just grateful to see that your wisdom and platform has increased since we last talked to you in May, and appreciate the contribution that you're making to the country, sir. I just wanted to say that before we got into the interview. How are you?
Good. Well, thanks for saying that. It's good to have at least a little bit of support.
A wise man once said, you know a lot about a man from the enemies that he has. So I think it speaks very well of your character, sir, at least in our corner of the universe. So a series of questions we have. We do a segment each week on the show, fake news or not. You are our special guest this week. We're trying to figure out what's real news and what's not. So some questions we wanted to ask you, Dr. Atlas, the latest on the virus. The first is, when it comes to masks, that's the new debate now, masks. I'm not anti-mask. All right. I actually suggested on this show in March, why don't we just wear masks instead of locking everything down? And a lot of people like Dr. Fauci and others said masks don't work. We don't need to wear masks. And now they're telling us that now Robert Redfield is telling us it's better than a vaccine. At least that's what he said to Congress, even though we see real-time data in countries and cities around the world, in states where they do mask mandates, and it doesn't seem to be, at least maybe it is in an individual setting, but in a wide populace, it doesn't seem to be a successful mitigation strategy. But am I wrong? What's the real data on the mask, Scott?
Okay, well, this is somehow taken on a life of its own, this issue about masks. As if it's the only thing that counts. But this is just one of the several obsessions that have happened during this pandemic. And honestly, it's an indication of how off the rails the whole discussion is, how hysterical the country is. And this country is an outlier in the level of hysteria, by the way, compared to anywhere else in the world. That's just my introductory statement. Okay, the policy that the president has, and my own advice on policy, is masks should be worn when you cannot socially distance, particularly when you are a high-risk or near a high-risk person. And that is exactly the policy that is articulated on the NIH website, which I'm going to read here because I happen to have it sitting here. Quote, when consistent distancing is not possible, face coverings may further reduce the spread of droplets from individuals with SARS-2 infection to others, unquote. The issue that was censored on Twitter, and I think this is very important for people to understand, is I stated that the widespread use of masks as a mask mandate for the general population first didn't work when it was used to stop cases, and that's proven, that's not arguable, in LA County, Miami-Dade County, Hawaii, Alabama, the Philippines, Japan, the United Kingdom, Spain, France, Israel, and other places. That's fact. That was in my tweet. Two, the Professor Carl Hennigan of the University of Oxford, who is the director of the Oxford Center for Evidence-Based Medicine, he's also editor-in-chief of British Medical Journal's Evidence-Based Medicine, said, quote, that despite 2 decades of pandemic preparedness, there is considerable uncertainty as to the value of wearing masks, unquote. That was in my tweet. The other thing that was in my tweet was a reference to the World Health Organization that says, quote, the widespread use of masks by healthy people in the community setting is not yet supported by high quality or direct scientific evidence, and there are potential benefits and harms to consider, unquote. That was in the tweet that was censored. We also know that masks, are important for medical procedures, or at least are customarily used for medical procedures, like the procedures I have done hundreds of times in my medical career, as opposed to an epidemiologist who's never done a procedure, parenthetically. And that is that masks are used to prevent you from infecting a nearby sterile situation by coughing or sneezing or in a medical world, in an open wound that is supposed to be sterile. And so, public policy involves common sense and looking at the data. And so to me, the policy of the president, the policy that I have advised, the policy that I was involved in setting here was that is appropriate because it's common sense, it's rational, it's when you're high risk or when you're in a high risk setting particularly, but masks should be worn when you cannot socially distance. If you're socially distancing, if you're in the middle of a desert, if you're driving in your car alone, if you're walking through a park outside alone, it is nonsensical, pseudoscientific, irrational to think you should wear a mask. And I'm sorry, but that's what a normal person, I think, would agree with. I would say something further, that anyone who would say masks are better than a vaccine should not be in a position of publicly even speaking about this issue. That is a really, really dangerous statement. That is a statement that will literally kill people if people listen to that statement, because high-risk seniors who are in the highest risk category for this disease are absolutely not more protected by wearing a mask than getting a vaccine.
Let's go to lockdown, Scott. I've read this morning, Chicago's talking about another lockdown with a second wave. The European countries that were all doing better than us, according to the media this summer, all looking at new waves of lockdowns. Hong Kong's done 3 waves of lockdowns. Did lockdowns work anywhere in the world? Anywhere?
Well, the problem with the whole discussion is people didn't even understand. They lost track of why these societal shutdowns were being done. The original shutdown that everyone was totally okay with was back in the early stages of this pandemic, when we didn't know the information. It was basically the world was blindsided by this, and that information that we had said that the case fatality rate was astronomical, 3.4%. Actually, I think was the number. And no one was prepared for something like that. It was impossible. So there was I think, a totally appropriate shutdown for short term to do 2 things. But number one was 90% of it, which was flatten the curve, quote unquote, this magical phrase that really had a meaning. And that meaning was to stop hospitals from being overcrowded, so that these people could be treated, and so that other medical care could go on, because other medical care is essential. And what then happened, the secondary gain of that was that we could have some time to mobilize resources, ramp up production of necessary equipment, including protective equipment, including ventilators, and also buy some time with developing at least in the short term help, trying to develop vaccines and drugs, which of course don't happen overnight. And that was a smart strategy. And in the United States, that actually was useful. There were very few, if any. There were some, but it was rare, hospitals that were overcrowded. There was a development, an immediate mobilization of emergency hospital beds, of personnel. There was a successful development of protective equipment, personal protective equipment, as well as ventilators. There was never a single person in the United States that needed a ventilator that didn't get one. There was a massive testing program developed from scratch, unprecedented. And by the way, there was a start given to developing drugs that are really important. And the Operation Warp Speed effort by the president, the administration, was a study that will be it was remarkable, and it will be emulated in the future, because it was a very smart, tailored strategy to do things safely and fast with the private sector. And in addition, by the way, a stockpile was prepared for future pandemics. So this stuff was smart. After the short-term shutdown, though, it got out of hand. People didn't understand all of a sudden the purpose of the shutdown. The purpose of the shutdown was absolutely not to stop all cases of COVID-19. It was not to stop all hospitalizations, and it was not to stop deaths. That was not at all the reason for the shutdown. There were other things done to stop deaths, and not just these longer-term development of drugs, but of course, using social distancing, which is important, doing protection of seniors, particularly prioritizing their equipment that they need to protect themselves, prioritizing testing to nursing homes, prioritizing infection control, prioritizing testing of the staff members that come in there, alerting communities with seniors, even in senior centers that are non-residential, all kinds of things. But in terms of flattening of the curve, it had nothing to do with stopping the cases per se, because when you do a lockdown, as we have seen all over the world, as you alluded to in your question, when you do that, you do not eliminate the virus. No shutdown eliminates the virus. The virus is there. All you do is delay the infection. And so we see the countries that were somehow convincing themselves they had, quote unquote, defeated the virus. And other odd, really irrational proclamations were made. And those are wrong, and we see it all over the world because the virus is there, and it was delayed. And so, what is the danger of doing that? Well, there's a danger of doing that. The danger of doing that, and particularly, I'll give you an example in the United States, which is where we live. When you have a person who's a public policy person recommending testing asymptomatic people, confining or isolating those people, healthy people, younger people, but asymptomatic people who are in the workforce, by the way, you're going to isolate them for 2 weeks. You're going to limit in-person schools because you're going to test schools trying to find asymptomatic children that are extremely low risk, in low-risk environments, colleges and schools, low-risk environments. You're going to shut them down. You're going to restrict business hours. You're going to introduce these very bizarre, arbitrary things like shutting bars after 11 p.m. This kind of stuff paralyzes society and literally is the definition of lockdown. And when you do that, for instance, now in the United States, if you were to try to do that, you're going to delay the cases. You're going to push the cases. You're not going to eliminate the virus, right? Remember, the virus is there. You're going to see the cases. What you're going to do is have these cases come later in the winter. What's the problem with that? Well, in the winter, we do not have the ability in most of the United States to use social distancing from our elderly family members. We do not have an ability to eat outdoors, have entertainment, see our family outdoors, because people are shut inside because it's cold out. This is the reality. And when you do that, and you couple that with the knowledge that the majority of cases, the most frequent place where cases are spread is in the home, not outside in the park, not outside in the stadium, in the home. And when you have that situation, and now you push cases into the winter in places in the Midwest, in the near West of the United States, on the East Coast, wherever you're going to do these so-called lockdowns and limiting businesses and limiting all these things, you're going to kill people. You're going to kill people because you're not going to have the capacity, the potential ability to use social distancing from the elderly, and that is what saves lives. And so that doesn't even take into account the debacle of what happens during a lockdown, which means that you have not only eliminated medical care, and I've said this many, many times, but the more recent data is, you have 46% of all of the 6 most common cancers in the United States were not diagnosed during this shutdown, partial shutdown. And by the way, no matter how these public health people say, they're opposed to the lockdown, then their policies, though, mean lockdown. Doesn't mean that everyone's zipped up in a bag, isolated from the universe. It means that there were restrictions on in-person schools, restrictions on businesses, paralyzing international travel. And these things again, I want to start by saying they eliminate medical care, and they eliminate medical care not because hospitals are closed. They eliminate medical care because these kinds of things, with these frenzied statements and focusing on what we don't know and focusing on everybody must be testing, even though they're asymptomatic. And we should seek out tests in toilet water in universities. And all these nonsensical things, they're destructive because they eliminate the medical care. These cancers didn't go away. They're just not diagnosed. People will come in and get them later, more widespread disease. Many of them will die. We didn't do the living organ donor transplants. 85% of them were not done. 2/3 of cancer screening was not done. Half of 650,000 people on chemotherapy didn't come in for chemotherapy. We didn't get acute stroke and acute heart attack patients didn't call the ambulance. Why? Because of fear. Because of fear involved in going into a medical facility. And so there's a massive healthcare crisis now. Half of immunizations didn't get done. The UN says 130 million people in the world will be in abject starvation level poverty because of these lockdowns. You have 400,000 more people will die from tuberculosis because of diversion of resources from that disease. We have massive problems with malaria that are going to come up because Africa's malaria program was eliminated. And, you have all of these disasters of closing schools because in-person schools are not substituted by online learning. That's a luxury of the rich. Okay, most people, they don't have that sort of thing.
Right.
This is a massive destructive process for low-income families, for working-class families who have been destroyed. And when we look at children, we notice, even just in the 2 months of spring school closure, more than 200,000 cases of child abuse went unreported, and they still occurred. But they went unreported because the number one agency for reporting child abuse is the school. And now we look at other things like longer-term.
I've got 10 seconds, Scott. I've got 10 seconds before I got to go.
Okay. 25% of people who are college age in the United States thought of killing themselves in the month of June due to the lockdown. The lockdown is a heinous abuse of government misguided policy.
Amen. Amen. Amen.